Good morning, everyone, or whatever time it is when you guys are tuning in to our very interesting and I think very timely panel series on depression specifically for today. So we have here today two of my favorite clinical psychologists within the Naluri team, Nicole and also Nidaa. And I don't want to steal your thunder, ladies, so I will kind of just quickly get you guys to introduce a little bit more about yourself and also maybe a bit on your experience working with patients or clients who may be going through depression. So maybe let's start with you, Nicole.
Hi, everybody. I'm Nicole. As mentioned, I'm a clinical psychologist. I think depression is one of the most common cases that we see in our practice.
Thanks for that, Nicole. And yourself, Nidaa?
Hello, everyone. I am Nidaa with Hani, and I'm also one of the clinical psychologists in Naluri. Throughout my experience for this, being a clinical psychologist, depression is the most common mental disorders that I've been handling with. And yep, I have been seeing even in Naluri itself, the number of people having this depression disorder is increasing bit by bit, and it's a bit worrying. But worry not, because we, the professionals, will be here to educate the community and all. Yeah.
Thanks so much for that, the both of you, for kind of sharing your take on depression. And actually, what was interesting for me was hearing the both of you say that depression is one of the most common type of cases that you guys see. So I want to kind of peel the onion a little bit on that, right? And before we get there, so depression, usually I think if you were to Google it, it appears in the same sentence with stress and anxiety, right? And I think that's the common assessment that's used, depression, anxiety, and stress scale. So maybe, Nicole, could you just illustrate a little bit on what is the difference between depression, anxiety, and stress?
I notice in my practice, a lot of people, when they self-diagnose themselves with depression symptoms, they're actually having or experiencing anxiety, and it can be vice versa. So I think actually they do share very common symptoms like anxiety, stress, and depression. And at the same time, they can coexist actually. We wouldn't say whether stress causes more cases in depression or depression can cause more anxiety, but it differs in every individual situation. I would say that the similar symptoms that they experience would be, having negative thinking, negative thoughts, and worries towards their future, or they have like negative thoughts about their past. They will also share symptoms like stress. Stress is actually one of the symptoms, one of the emotions, common emotions that people who are depressed or anxious, they can feel. There's a type of nervous energy around them, or they may also have certain avoidance behavior. They are always together because they share similar symptoms, like I mentioned. I don't think it always come together.
Then maybe Nidaa, could you highlight, or illustrate a little bit more, like what are the distinct differences between depression and anxiety? And then also, is there a formal definition of what depression is? And does it differ on day-to-day depression or depressive symptoms versus clinical depression?
All right. So there are distinct features among depression, anxiety, the usual depression, and whatnot, right? So we need to know that all this depression and anxiety is under one roof, which is what we call as mood disorder. Okay. So what different is depression is more into sadness, right? Prolonged sadness. And then they feel like, oh, I don't want to do anything else. Like I don't have the interest to do things that I used to do. For example, you used to exercise. So you feel like so fun in doing exercise. But then at some point when depression hits, you feel like, you know what, I don't like to exercise anymore. I don't like to read anymore, for example. And even I don't like to work anymore. I don't have that kind of motivation. So when it comes to depression, it's always about two things: sadness, as well as the low of interest, that we don't have that interest anymore. While anxiety is about like worrying. you keep on thinking about the what if. What if this thing happened to me? What if I go outside and then I got like panic attacks? So it's all about a do, you know, or your palpitations, that your heart is beating so fast, and then you start to trembling, you start to shaking, and all of that. So you can see the difference. Anxiety is much about worriness. Depression is much about sadness, but both are under mood disorders. It can happen at the same time. So, for example, you have anxiety first, and then because of the anxiety symptoms that you find that you cannot cope very well, it can develop into depression. So vice versa as well, like what Nicole said, right? And then you can develop depression first, and then slowly, and then after 2 years later, you can develop into anxiety. When it comes to clinical disorders, it's always about the normal line. There is always a normal line. Can you imagine like a line here? Okay, we as a human being, we have the anxiety. Okay, we need that anxiety. We need to have sadness, because that's what defines us as a human, right? So when it comes to depression, so there's always a normal line that, let's say, for example, we are here. When you are above the normal line, it will be a clinical disorder of depression. Okay, so what makes it different is when you have this prolonged sadness. Okay, when you have this prolonged what we call as we lose interest, right? Like I said, for more than 2 weeks. Okay, and this symptom is prolonged for 2 weeks. Even like for 3rd weeks, you still have this kind of feeling. That is when you should reach out to a professional already. Okay, so when these symptoms actually affected your daily living, okay, you need to pay attention to this. When it affected to your daily living, you don't want to sleep anymore. It's not that you don't want, you cannot sleep anymore. You feel like you don't want to eat. You just cannot eat, or you feel like you eat too much and things like that. You don't want to see people. You cannot work anymore. So because of our daily functioning has been affected and it has been prolonged for 2 weeks, that is when you need to reach out to a professional.
So then on that, right? So if I kind of understand that correctly, is that sadness is a key part of life. There is kind of normal grief process, right, where sometimes things happen and we feel sad about it, but then it's truly when that sadness happens for longer than 2 weeks, and then it starts to impact your day-to-day functioning. Then that's kind of a good cue that you should maybe reach out to a healthcare professional. Yeah. But then just on that, and I think I wanted to kind of zoom into one thing that you said, Nidaa, and maybe for you, Nicole, to share your thoughts on this, is this interesting concept of an individualized normal line, right? Because I'm assuming here, and do correct me if I'm wrong, that we all have our own different threshold of like how much sadness we can take, or I don't know if it's like resilience. So on that, Nicole, do you have any advice around how a person can develop that level of, I guess, self-awareness of what normal is to them, so that they know when they should reach out?
Yeah, just like what Nidaa said, right? Actually, duration plays a key role. It determines like whether it can be called as an episode based on the DSM-5. Of course, we are not as rigid, like, you have to experience it like for 14 days, or if it's like 13 days, then it's not counted. But I think another key point is also to look at how it impacts your daily life functioning. Like, does it impact your work? Does it impact your social life? Most of the time, we give a diagnosis is to make sure that the client can get the proper treatment. A diagnosis does not mean like, you are weak, you're depressed, you're different from most of the people. But the diagnosis is to bring the awareness to say that, okay, look, it is really disrupting and interfering your daily functioning. So I guess, what you asked, I think one very important point that people can be more aware is to see how they perform, how they function in their work. Do they feel like they are being limited by their emotions most of the time? Do they feel like they are being controlled by the emotions? Like, for example, you are so sad. You mentioned like every individual has a different threshold, right? And if you are so sad that you couldn't even find anything that motivates you to get up from the bed, or you find yourself, not submitting your projects before the deadlines, and then you are seeing that you are potentially putting yourself in danger of getting fired, something like that. Yeah, that would be an indicator that, okay, it's time for you to reach out to get another person to help you. And just to share about, when we talk about this, I was thinking about how people get resistance to see a psychologist because they will be very afraid of getting the diagnosis. Well, seeking help, it doesn't mean that you are getting a diagnosis and then that's it, and then we will just leave you to heal on your own. But getting the diagnosis, recognizing the difference between the sadness and your depression, by being able to define them, actually will help you to improve your well-being. It's just like all of us will need help once in a while from other people, and reaching out really just mean that I can't really see what's going on with my life right now. I'm overwhelmed by my emotion, and reaching out would be like to get another person that is not involved in that loop of emotion, and he or she will be able to share a different perspective that you may not thought of. Yeah, maybe to pull you, or you can say like to pull you out of some difficulties in life.
I think we can all agree that yes, in Malaysia, we are making some progress in terms of destigmatizing mental health, right? And I think COVID-19, for all the bad things that it has created, I think on the plus side, it has also forced a lot more conversations around mental health, right? Which I, for one, am extremely excited about, and I'm sure both of you are as well. So I want to understand a bit around Malaysians, or kind of any patients that you guys see. What is the general sentiment, or how well do people receive diagnosis? And I think I would love to hear also like stories, if you guys are able to share, on typically what are some of the initial reaction that people give you guys when you get to them and say, I am sorry to inform you that this is your diagnosis. And actually, I don't know if you guys do say that, but how are those conversations playing out within your therapy sessions? Maybe let's start with you, Nicole.
Yeah, so for me, right, I usually don't diagnose in the very first session because I think it's only fair for me to take some time to really evaluate and assess that individual, because like you mentioned, sadness, it's one of the symptoms of depression only, right? So there can be a lot of events that leave people feeling very sad and hurtful, like loss and absence of a loved ones, losing a job, or betrayal of your loved ones, or failing an exam. So usually, right, when we really think that, okay, it is really important for the client to know about the diagnosis so that the client will be able to, for example, reach out to a psychiatrist to get help in terms of the medication. For me personally, I don't tend to apologize for giving them a diagnosis, but rather I tend to normalize that, hey, and also psychoeducate them about the diagnosis and say, hey, it's the purpose of the diagnosis is to get the right help, and it doesn't show that you are different from other people. And I guess it is important for me to emphasize on the point that every one of us do get depressed in our life. Like what Nidaa has mentioned, sadness is really part of our life, and our life has its ups and downs, and it's very normal to feel depressed, especially during this pandemic that life has been like so challenging, unprecedented, and confusing, right? So it's normal to feel a little bit, less motivated, or maybe you're overeating during this period of time, and maybe having a bit more sleep, or having difficulty in falling asleep. Yeah, so at the end of the day, we help the client. We were I will be very upfront with my client to let them know why I would share this diagnosis with you.
And Nidaa, yourself?
So before this, my experience is, so I came from hospital settings, so I can see the difference, like the reaction of people in getting diagnosis from hospital setting and as well as from the private setting, right? So for those people who are from hospital setting, of course, like what Nicole said, we need to normalize this thing, okay? Because we don't want them to like, oh my God, I have depression. No, so we normalize first, and then we go down even details like to explain about depression, like giving psychoeducation. So giving psychoeducation is like we just telling you the details about depression, that what you are experiencing, in terms when it comes to your thoughts, when it comes to your emotions, and when it comes to your behavior. Okay, so depression is all about these three things, right? So we discuss about that in a very like layman terms, okay, and then like explaining symptoms, their symptoms in daily disease and whatnot. Okay, what would they feeling and this and then for those people, I can see the difference is like from those people who are from hospital setting. So I usually give diagnosis like from the second session and onwards. Okay, I rarely give diagnosis for the first session, because first session is all about like we discuss things, right? Even if this person need more observation and then more exploration, and then the diagnosis can come later. Okay, so but what more important right now is how should we do about your current situation. Okay, so sometimes we need to understand also that diagnosis is actually for us, the professional, to determine the treatment plan. Yeah, so that's why we give diagnosis. So you need to know that with the psychologists, we don't work alone. So we work with counselors, we also work with psychiatrists, also the different part of psychiatrists like neuropsychiatrists. We also work with the other disciplines as well. Okay, so giving diagnosis in this team really helps in terms of like helping you out as a client or patient in determining the treatment plan. Okay, so for those who come from private settings and whatnot, they usually like more calm. Okay, this is like my personal observation, right? So more calm in receiving diagnosis. Yeah, because most of them, they usually like do like research first, and then they talk to professional to confirm what they've been thinking so far.
Nice. So I think the two takeaways for me is, when you guys diagnose, you try to normalize it, right? And I think that is something that is maybe slightly different from when medical doctors give a diagnosis on physical health conditions, right? Because it's usually a little bit more doom and gloom when it comes to certain conditions, and it tends to be something that is hard to normalize. So normalizing it is the first key takeaway. And the second one is then it's the diagnosis is to serve the purposes of giving clarity on the treatment plan. So maybe Nidaa, could you share a little bit more on, right? And I'm sure, it's kind of different for different people, but what is the common treatment path for someone? And are there kind of different branches of depression that then leads to different types of treatment plans?
So when it comes to like different branches in depression, yeah, we do have different types of depression, okay? But the most common one is the major depressive disorder, okay? What we call as MDD, okay? Major depressive disorder. So that is the most common one. So the other branches is like depression, like postpartum, or what Malay people call as meroyan. So after they are pregnancy, and then they couldn't cope with the symptoms, so they have the postpartum depression. Also like depression due to medical illness. Let's say, for example, you have cancer, and then you couldn't cope with it because you know, like having cancer is very huge things, right? So you develop this mental disorder, what we call as depression, due to medical illness. So the treatment. So when it comes to treatment, having a clear diagnosis really helps. Okay, so let's say, for example, so I will talk about the MDD because that is the most common one, right? So we have different types of treatment as well. Okay, so yeah, it can be about like depending on that patient or depending on that client as well, right? So some client, I think the most common one is CBT, what we call as cognitive behavioral therapy. Okay, so CBT is what we alter your negative thoughts, okay, to make sure that you produce good behavior and then good feelings afterwards and whatnot. So that is the most common type of treatment, CBT. Okay, the other part is, of course, we have mindfulness. So mindfulness is we put much focus on present. So we teach them how to be aware, how to be present in your daily life basis. Okay. So, and then the other part is if we see that this client has so much impacted from their childhood experience, from their past experience, so we can give out the other treatment, what we call as psychodynamic. Okay, so this treatment will focus much more on the past, okay, rather than the present. Okay, so we have different types of treatment that is much depending on the cases, depending on the client. If this client like feel like, oh, I cannot this treatment, we can always jump around. Okay, we are very, very flexible in this.
And Nicole, in your experience, when do you then bring in people from different disciplines, right? Maybe a psychiatrist or any other kind of healthcare professionals that you want part of a person's treatment plan?
I think during our first session, we call it as a diagnostic intake session. We would use that session to really understand the background and the person's manifestation and the causes of the whatever presenting problems that our clients show, right? So why am I talking about this is because even though a lot of people can share the same symptoms of depression, but I always see that they feel it's a very personal and individualized experience. So when do I bring in like the other mental health professionals to in the discipline, right? It's when typically it's when a client feel like he or she cannot manage and handle, and talk therapy is not very helpful to them. So maybe we will have to bring in medication to help them to relieve the symptoms so that they will be able to receive the tips and techniques about how to manage their symptoms better. Yeah, so I think it also depends on the therapist's approach, because every therapist has a very different way of handling depression cases. So I think CBT, yes, is one of the very common ones. And one of the techniques under CBT, right, is called behavioral activation. It's typically used on depression cases. Yeah. And when we talk about depression is the emotion. And in CBT, we look at how our thoughts affect our emotion. So in that way, we will try to replace or alter the thoughts, because it has a full impact on the emotion. It causes us to feel a certain way. How we think makes us feel a certain way. Yeah, so it's about changing perception about your environment and also towards yourself, that we find it helpful for the depression clients. Yeah, whether they are diagnosed with MDD or they're experiencing depression symptoms.
Okay, so I want to hold the thought on that. I want to get back to that. But before that, I just want to first understand kind of the role of medications a bit better when it comes to treating someone with depression. And I think my very basic understanding is that medications help with sometimes balancing like neurochemicals in your brain. So then on that, Nidaa, are there kind of differences in terms of whether or not certain groups are more predisposed to depression due to, I don't know, starting neurochemical levels, for example?
Good questions, Tiffanie. Okay, so when it comes to predisposed factor, so we usually will detect whether this person has predisposed factor on this client or not, right? So the predisposed factor that we can see is mostly around genetic, okay, and then the personality itself. All right. So when it comes to this, yes, of course, the medication does play a role in like for a part of our treatment, right? So let's say, for example, when you have eaten like antidepressant, when you have been prescribed by antidepressants, so somehow it will like inhibit our neurotransmitter, and then because the medication works both ways. Either they inhibit the neurotransmitter, or whether they like block certain or what we call like increasing our neurotransmitter of like being happy. Okay, so it does work in these two ways. So it plays around your biological condition of our brain and whatnot. So whether they increase our happy neurotransmitter or whether they block our like unhappy neurotransmitter. So I'm not gonna go into like very scientific terms. Okay, so I just like try to explain in a very layman way. Yep.
So I think, of course, genetic factors, I think, is something to consider, and then personality type. But then, do you guys see gender differences or even generational differences? Maybe Nicole, on your part.
The statistic, they actually found that women are more, what's the word? Women have more, there are more depression cases. There are more depression cases in women. So apparently, right, they also found like highest prevalence in Putrajaya. And then secondly, it's Negeri Sembilan. So it's really interesting to see like by states, there are also differences in the number of depression cases. And also female are actually more prevalent in depression compared to male. And people who live in the rural area has more depression cases than people who live in the urban area, and people who are single, interestingly, got more depression cases or depression symptoms as well. So I think these figures are really interesting to look at, but at the same time, I'm also concerned a little bit about the underreported cases. I mean, in my experience, I know that a lot of people are still quite reluctant to seek professional help. And I also know there are some of the practitioners who will also feel quite reluctant to give a diagnosis because maybe the client is not ready to accept the diagnosis, no matter how much psychoeducation you share with them, they may still feel not ready for it. So sometimes the practitioners do just keep it to themselves to treat the symptoms, to manage the symptoms, rather than to tell directly like, hey, you're having a depression disorder.
Thanks for sharing that stats, Nicole. And I think, there are 1,000,001 possible reasons as to why there are differences in states, and then even the gender differences, like could it be a matter of like willingness or openness to share, right? Or acceptance of diagnosis, and then therefore the therapist also being more willing to give the diagnosis, right? So I think, we won't get into that. But I wanted to touch on, kind of as I reflect now on the definition of depression, right? It is largely related to reflecting on past events and ruminating on past events. And then I think, kind of what you said earlier too on the psychodynamic type of therapy option, which is quite common, which then kind of goes back into things that may have happened within the childhood. So then this makes me wonder then, does managing depression, or rather preventing depression symptoms in adulthood, does this need to be something that is actively pursued when people are in their adolescence or like childhood age? So how important is kind of early education and awareness for something like depression? Because I saw the same survey, Nicole, and I think, if I'm not mistaken, it was 50% of people are struggling with some form of a mental health condition, and that number is shocking. So yeah, would love to hear both your views, right, on just how important is early education. Maybe let's start with you, Nicole.
Definitely, they always say that the earlier that you know and understand the situation, the better the treatment plan can be, because the longer that you put yourself into that situation, it can get very complicated. Like, for example, if it's related to a lot of, past history, the past experience that you have, the longer that you let it sit in the past, the more complicated it gets. You may even forget some details about it, but you remember how it made you feel. So I would say definitely early education is very important, and it will also help people to feel normalized, to be normalized in terms of the disorders, and not to be too afraid when it comes to seeking help.
And Nida, from your side, what are some of the advice that you would give either parents or education institutions on how they can normalize conversations around mental health from an early stage?
All right, so especially for the parents and how to take care of their teenage kids and whatnot. So definitely, when we want to do this, we need to have that knowledge first. You can even search over the internet, and even it is much better if you have like friends who are in this sector, in this healthcare sector, to like clarify what you know about depression. So first of all, having a good knowledge is really really needed to be able for you to be able to like educate others. Okay, so when it comes to this, so that this parent, when they have this knowledge, they know what to say for their teenage kids. What are the things that they need to observe? They need to understand that different milestones will have like develop different mental condition of that particular child, let's say for example, right? Okay, so what kinds of parenting style, okay, do they want to adopt to this teenage kids and whatnot? So when they see some things, okay, when they see some symptoms, let's say for example, why my teenage kids like always stay in the room all the time, or what's wrong with that? So having knowledge about that that can help in terms of like approaching the teenage kids and whatnot. So being a parent, it's all about like you need to understand the milestone of the kids, and even like if you are a manager, let's say for example, right? So you need to understand, you need to have this kind of knowledge to be able to see symptoms of your colleagues, of your team members, and whatnot. So yeah, I would say like having knowledge is really really important for this. Also like to have someone to speak about, like don't feel like you are alone in this, so reach out. Yeah.
And so you have touched on actually my next question, right? Which is
really?
that moving from school, and then I guess naturally you get into the workplace, right? And I think we can all agree that we have read too many different articles out there on how mental health is becoming a bigger and bigger concern within a lot of different organizations. So what advice would you give an employer or maybe the HR teams within companies on what they can do to better support their employees at a time like this, Nicole?
I think, prevention is always better than cure. In short, I think mental health stands, it's getting more and more important because everyone is working from home, and it does take a toll on our mental health. Yeah. So I think as an employer, I've actually heard this very interesting news. I think in the UK, there are a few organizations actually had mental health sick leave for the employees. And I think that's a very good approach because mental health is actually equal to physical health. The importance are the same. And by allowing your employees to be able to take some mental health leave, it's actually also helping them to be more aware and recognize the symptoms they are going through, and also to let them know that it's okay if you feel a little down sometimes, and you just needed to care for yourself, to take time and help yourself with your whatever that you're going through, and then come back whenever you're ready. So I think that can be, I know it can be very difficult to implement it in Malaysia, but I think that's a very good way to also show how the employer actually care about the employee's mental health. Yeah, because it's not really about the outcome or the result all the time. The process is also very important. So if the employer can be more supportive in terms of the mental health of the employees, it can really help to produce even better outcome.
Got it. Hopefully, if we have any HR folks or employers who are listening to this, this is something that I too feel very strongly about, right? Of course, like what Nicole said, it's hard to institutionalize it, right? To say in the employment contract, you have like X number of days of emergency days, X number of days of mental health days, right? That's going to be hard to formalize based on our employment laws, but it's something that employers can still do in a soft manner. But then it's importantly, as Nicole very, very nicely put, it is about the process, because it is through your process that you show your support. So I really like that, Nicole. Then I think onto you, Nidaa. One thing that also came to mind is then, of course, loneliness, right? Especially in COVID-19 and lockdown and all that. And there's been a lot of studies linking loneliness with higher risk of developing depression, right? Or exhibiting depressive symptoms. What are some of your advice that you would give to people who may be experiencing loneliness? And sometimes with loneliness, and please do correct me if I'm wrong, right? It's not so much about not being around people, because sometimes you can be with people, but you still feel lonely. So now with all of this like Zoom sessions and virtual social interaction, sometimes it doesn't quite feel the same and people still feel lonely. So what would you advise people on how to better cope with feelings of loneliness?
So the feeling of loneliness, like what Tiffanie has said, right? Like even though you are full of a group of people in one room, you can still feel the loneliness. So the loneliness is something that if it's empty inside, right? Like even if you have like someone beside me, I can still feel loneliness. Okay, so there are things that actually we feel that it's not fulfilled yet, or it's not fulfilled at that particular moment. So let's say, for example, social isolation, right? So first of all, we need to know that a lot of people are experiencing social isolation. Like in fact, me also, I'm staying alone and whatnot. But that's the thing. Like even if you are staying alone, sometimes you don't feel the loneliness. But even if you are staying with a group of people, you can still feel the loneliness, right? So I think the most important thing is the first of all, try to detect the trigger of it. Okay, need to reflect, sit down, and what are the things that I want actually right now? What is the thing that makes me feel this way? Okay, try to reflect. Take your time to reflect and see where's the trigger. Okay, because when we learn about the trigger, then we know how to cope with it. To find someone to talk to is also the one thing that we need to be good at. Okay, for example, there are people that we can talk about this thing. There are people that we can talk about the deeper things, right? So do we have that kind of person in our life, to talk about these deep things, what we feel, someone that we can be fragile with, someone hey, I'm sad, as simple as that. Okay, so my advice would be learn the trigger, okay, see what is empty inside, and then of course the other things such as you need to go out. I would say you need to move around, get yourself move, okay? Even as simple as jumping jack 10 times in front of your mirror, okay? But get your move, because of when you feeling lonely, your thoughts will linger. That is dangerous and we don't want that, okay? It's not because of you ruminate about things. Sometimes we overthink. Sometimes we create things that is not there. So we want to avoid that. So you need to just move and go out and just see people out there, do something. What I'm trying to say is to not sit still.
Jumping jack at least 10 times. Okay, you can hold me accountable to that at some point this week. And Nicole, from your side, besides loneliness, are there any other potential red flags that we should all be mindful of, especially in this current lockdown situation that we are all in?
I think from my experience during giving therapy during this period of MCO, most of the times my clients would complain about not having that work-life boundaries. They will usually find themselves having to work more hours, or actually put themselves working for more hours than the normal times. And also they may feel guilty if they are not replying to messages when their employer or their bosses send them a message. when they are on the phone. So it's really, I think it's something that we need to be aware that even though we are working from home, we have moved everything up from the office to home, and maybe some of the employers may also, I wouldn't want to call them like insecure, but I think everyone is like very new in this, and everybody is trying to adapt to this new normal, right? So maybe things are very different from how it used to work in the past. Like maybe like after 6 or after 8 p.m., you had your OT, and then the moment you leave the office, you can put your work behind. But most of the time when I hear how my clients describe their experience, right, I sense that it is the pressure that they give themselves more than what the employers actually gave them, because it has a certain standard that they set for themselves. Like they will feel it's really hard for them to detach from work, and everything is maybe, you know, some people don't even have a separate room to make it into office. They do work in their bedroom, so everything just got mixed together. I think, you know, we forgot, you know, to take rest sometimes, and we would just thought like, oh, it's a little bit of work, let me just finish this up. And then when you are lying on the bed and then you see your laptop just right in front of you, it kind of reminds you of the task that you have to do. And this can cause a lot more stress and anxiety and even depression symptoms. Yeah, you know, I do have clients who tell me that they feel more depressed during this time because they don't have a life. You know, that's how they call it. And it's really important for us to strike a work-life balance, especially, I think during this time, we really have to consciously have a cutoff point. Yeah, like I told my clients, it doesn't have to be a rigid like 9 to 5 working hours, but set the time for yourself. Do whatever that makes you feel comfortable. Like maybe you are a night owl, you can choose to work at night if it allows you. I mean, if your job allows you to do that, or if you think your job is really heavy on the weekdays, you can actually set, you know, 10 a.m. to even 9 p.m. As long as it has a cutoff point, you'll be able to deal and manage your emotions better. Yeah.
Jumping jack, cutoff point. And just to end today's session, Nidaa, what is the one tip that you would give someone to better manage work-life balance?
Okay, as long as you know that your work has been fulfilled, I mean, the rights toward your work has been fulfilled, and also the right for you to become a better version of yourself is also being fulfilled. Okay, so the key is to be moderate in everything, like to be moderation in everything, and find a balance between it. Be flexible on it, because like the ability to be flexible on this is the sign of intellectuality. Okay, so be flexible. Okay, make sure that you still need to do work, but of course you still need to focus on yourself. Just be flexible.
Okay, wonderful. So just to wrap up today's session, again, thank you both very, very much. I have learned a lot from today, and I like how we are kind of wrapping this up with some very practical tips that I hope our audience will also try to have a go at, after listening to this. Are there any final words at all from any of you on what you would like to leave our audience with on the topic of depression?
I think I agree with Nidaa so much, you know, everything in moderation, right? And at the same time, I think another thing that I would like to remind everybody is to be self-compassion. Yeah, is to be kind to yourself. It's a difficult time. And everyone is in this. Don't be too harsh on yourself. If let's say you feel the difference, like maybe you are not as productive as before, or maybe you have felt sadder, than the normal times. Don't feel guilty for feeling that depressed mood. Yeah, it's something that is normal, like anxiety and stress. We all need that in our life. But with just the right amount, of course, and believe that you are able to get through this, even if you don't see the light at the end of the tunnel. There are always help available around you. Yeah, like Naluri. Yeah, you can always book a session with us. I think personally it's very helpful to know that someone will always be there if ever I need to express myself. There's nothing wrong to feel depressed and to feel challenged in this moment. Even though you may be very gung ho and you were like a Superman or Superwoman, before this, but we all have our down times, like, and it doesn't mean that you will feel like this forever. Yeah.
And Nidaa, from you?
Yeah, so I think in addition to that, I really, really agree that we need to embrace our sadness. Like if you feel sad, just go and cry, right? So if you feel that you want to sleep, just go sleep first, okay? But at the end of the day, it's all about like how you learn about yourself. So I would say pay attention to yourself. Okay, so especially like before you sleep, so try to reflect how you feel, how you think, because I think that when we know ourselves, we know what to do, or we can like, oh, I need to do this. Okay, this isn't work for me. I shall like jump into the other things. Okay, so be mindful, aware of your own feeling. Okay, so my key in addition to Nicole is learn about yourself. Then just learn every day.
Okay, cool. Thank you, everyone, so much. Bye.